Hello, my name is Michelle Ross. This presentation is on crisis conditions. I am an MSN student at Mount Mercy University, and this is for our Global and International Health course taught by Dr. Kathy Homard. During this presentation, I will review an example of a crisis condition. I will review how that crisis condition can impact specific populations, and also review the responses to crisis conditions from local level to international level. While many communicable diseases cause global crises, this presentation will focus on the hepatitis A virus. The World Health Organization, or WHO, described a hepatitis A infection as inflammation of the liver. Illness can range from mild to severe. Symptoms include fever, body aches, decreased appetite, nausea, vomiting, and jaundice. Transmission is mainly through a fecal-oral route. For example, if an infected person is preparing food or water for others, they may contaminate that and cause an outbreak in those ingesting those items. Another example shared was that of unclean drinking water or water that has been contaminated with feces, causing an outbreak. Oral anal sex would also be a mode of transmission. Factors that may contribute to an increased outbreak are poor sanitation, unsafe water, or those that may be vaccine naive. While hepatitis A is an issue globally, all of Africa is at an endemic rate. Endemic means that the disease is constantly present. Other Middle Eastern countries, such as Turkey and Saudi Arabia, have high rates, as well as parts of Asia and South America. Plessis et al. Shared in a 2022 report that 1.5 million people across the globe are infected each year with hepatitis A, and that mortality rates are highest in parts of Africa and Asia. This specific study linked these rates to a high prevalence of HIV in these countries. The WHO estimated that over 7,000 people died from hepatitis worldwide in 2016. They also shared that hepatitis A epidemics can happen suddenly, or it can be a chronic outbreak, sometimes lasting for months in certain regions. Other causes or commonalities in these parts of the world are the lack of safe water and sanitation systems, vaccine availability and education, and safe sex practices and education. Those most at risk are those in low to middle income countries, IV drug users, and men who have sex with men. There are several ways that a global crisis can be managed. Starting at the local level, we have public health departments. These departments have many responsibilities, examples such as tracking outbreaks of diseases, educating on vaccines, and promoting public safety. Since hepatitis A can lead to a larger outbreak, it is important for the public health department to investigate. In Iowa, the Iowa Disease Surveillance System, or IDSS, is used by the public health system to communicate with providers. They gather information and investigate where the outbreak may have started and who may be affected. Our public health departments are supported at the national level by organizations such as the Centers for Disease Control and Prevention, known as the CDC. The CDC sets standards for immunization schedules as well as education on reducing spread. Through the Advisory Committee on Immunization Practice, ACIP, they recommend that children ages 12 to 23 months be routinely vaccinated, as well as adults at risk for the virus. On a broader scale, we can look at response through a regional level. As shared previously, there are larger outbreaks and concern for outbreak in select countries. For example, most African countries are at a higher risk for hepatitis A outbreaks. South Africa, though, is currently seeing less outbreaks. They do have hepatitis A vaccines for those in the private healthcare sector, but that is only currently 15% of the population. Those vaccines are given before 2 years of age. Lastly, on an international scale, we have the World Health Organization, known as the WHO. Headquartered in Geneva, Switzerland, and pictured here, the WHO stated their role is improving local health systems and coordinating the global response to health threats. They truly are the overarching support to all our other responses, and often policies and protocols will begin there and make their way down to the other responding levels. For hepatitis A specifically, the WHO also promotes vaccine development and schedules. They also support and educate on clean drinking water and food sources. In summary, there are many crisis conditions affecting our world. All individuals can be at risk. Those in low or middle income countries may be more at risk. Luckily, whether promoting education on clean drinking water, safe sex habits, or food contamination practices, or through supporting vaccine development and implementation, there are many educated and caring people and organizations dedicated to reducing crisis conditions globally. Thank you very much for listening to my presentation today. My email is here. If you have any questions, I'd be happy to answer them. Thank you.